Okay, today we're going to tackle a question that has been a huge source of stress and anxiety for so many expectant parents. We're breaking down a major new meta-analysis from the Lancet, and it gives us the clearest answer yet on the safety of one of the most common medications in the world. Let's get right into it.
So this is the big question. Is it safe to use paracetamol, which you might know as acetaminophen, during pregnancy? I mean, this is by far the most common medication used, with some estimates saying up to 65% of pregnant women in the US use it. But for the last few years, there's been this intense debate and a lot of public concern about its safety. So what does the best science actually tell us?
All right, let's not bury the lead here. The short answer, based on the absolute highest quality evidence we have, is yes. When it's used as directed for a valid medical reason, there is no clinically important increased risk of neurodevelopmental disorders like autism, ADHD, or intellectual disability. Now, that's a big, reassuring statement, so let's unpack exactly how this study got to such a definitive conclusion.
To really appreciate why this study is such a big deal, we first have to understand the backstory. Why was a massive analysis like this even necessary for such a common medication? It all goes back to the controversy that created so much confusion.
The anxiety really kicked into high gear around September of 2025. That's when a suggestion from a U.S. government source raised alarms about a potential link to autism, and that, understandably, created a wave of public concern. But what's interesting is that even before then, huge studies out of Sweden and Japan were already suggesting that other factors, not the drug itself, were probably the real issue. So you had these conflicting signals, which created a critical need to synthesize all the best evidence and finally clear the air.
And this put parents and their doctors in a really tough spot. I mean, think about it. On one side, you have this potential but unproven risk from the medication, but on the other side, you have the very known, well-documented risks of not treating conditions like a high fever. We're talking proven links to things like miscarriage, preterm birth, and serious congenital defects. So getting this right wasn't just an academic debate, it was an absolutely critical clinical question.
So how did this meta-analysis cut through all that noise and provide such a clear answer? Well, the key, as it often is in science, was in the methodology. It was specifically designed to filter out the static from earlier research by focusing only on the highest quality studies and, crucially, controlling for the factors that had confused the picture before.
And here is the secret weapon of this analysis. It's called the sibling comparison design, and it is just a brilliant way to answer this kind of question. By comparing siblings from the same family, where one was exposed to paracetamol in the womb and the other wasn't, you automatically control for the vast majority of shared genetics and family environment. It's an incredibly powerful method that lets researchers isolate the effect of just the medication with much greater precision.
And believe me, the researchers were incredibly thorough. This being a meta-analysis, they systematically combined the results from many different studies. They started by searching for every relevant article ever published, over 4,000 of them. Then they meticulously screened all of them for quality. And most importantly, they gave the most weight in their final analysis to those powerful, high-quality sibling comparison studies.
So, after all of that incredibly rigorous work, what did the numbers actually show? Let's get to the results, because this is where the case for safety really becomes clear.
Now, this table might look complicated, but it's actually pretty simple. Just focus on that column called odds ratio, or OR. An odds ratio of exactly 1.0 means there's absolutely no effect, no difference in risk at all. Now look at the numbers for autism spectrum disorder, 0.98. For ADHD, 0.95. For intellectual disability, 0.93. You can see they are all so close to 1.0 that, statistically, they are indistinguishable. This is about as powerful evidence for no effect as you can get.
And if you're a visual person, this bar chart makes the point even more dramatically. That vertical line right in the middle is the no effect line. That's our 1.0 mark. And as you can see, the bars for all three conditions are practically sitting right on top of that line. It's an immediate, clear visual confirmation. The highest quality data shows no meaningful association.
So this brings up a big question. If it's not the paracetamol, what explains the weak links seen in some of those older, less rigorous studies? Well, this quote from the study gives us the answer directly. The researchers say that factors that run in families, things like genetics and shared environment, are a much more plausible explanation than any direct effect of the drug itself.
Let's break down those other factors, or confounders. Past studies were often tripped up by three main issues. First, they couldn't separate the drug from the reason the drug was taken. For instance, a severe infection causing a high fever might be the real risk factor.
not the paracetamol used to treat it. Second, they couldn't account for powerful genetic and family factors. And third, many relied on memory or recall bias, where a parent might remember medication use differently after the child gets a diagnosis. The sibling comparison design helps correct for all of these issues.
Okay, so we've looked at the problem, the methodology, and the findings. Now let's get to the most important part. What does all of this actually mean for pregnant individuals and their doctors?
The great thing here is that this new, powerful evidence doesn't actually overturn existing medical advice. What it does is strongly reinforce it. It provides a solid foundation of confidence for the guidance that major medical authorities around the world have had in place all along.
And that consensus is truly global. We're talking about the world's leading obstetrician organizations, from the American College of Obstetricians and Gynecologists in the US to the Royal College in the UK, all the way to the World Health Organization. They all recommend paracetamol as the first-line, go-to treatment for pain and fever during pregnancy. This study provides the strongest evidence yet that their guidance is spot on.
So here is the clear, actionable take-home message. When used as directed for a valid medical reason, paracetamol is safe. And what's more, using it is often crucial, because choosing to avoid it could mean leaving a condition like high fever untreated, and we know for a fact that poses a direct and proven danger to the developing fetus.
You know, this study is such a powerful reminder of why high-quality research is so important. In a world with so many conflicting headlines and so much information overload, it's studies like this that use rigorous methods to separate a weak association from true causation that give us the clarity we need to make informed, confident health decisions. And in this case, the decision is thankfully very clear.